Okay, Professor. Today I'm going to talk about anti-ulcers agents. And I think it was very interesting because at my job, I give it to my patients every single morning. I work overnight. And most of these drugs we have to give to our patients with an empty stomach. And I'm pretty familiar with them. So every morning around 5:45 or 6 o'clock, I gotta give it to them before breakfast comes, at least 1 hour. So I'm gonna talk about these three drugs here: omeprazole, famotidine, and sucralfate. So the etiology about the anti-ulcers is that most of the ulcers that patients have it is, one of them is because the chronic use of NSAIDs is aspirins, ibuprofen, and naproxen is the non-steroidal anti-inflammatory drugs, weakens and thins up the mucosal lining of the stomach and duodenum, forgive my French, and greatly contributes to the formation of breaks in the protective lining, causing the ulcers. 90% of the ulcers is caused by the pylori bacterial infection. Is a Helicobacter pylori bacterial infection. So also heavy alcohol use and smoking increase the risk of having PUD in patients with H. pylori infection. Other contributing factors include various illnesses such as Crohn's disease, gastritis, hepatic disease, and pancreatitis. Complications of peptic ulcers may include anemia, profuse bleeding, perforation, and obstruction in certain cancers. So this is the lining of a healthy stomach. Is very smooth and very clean. And look at the one with gastritis, how crowded and very busy. And this guy is in a lot of pain. It causes a lot of pain for most of the patients. So various agents with different actions mechanisms used to treat or reduce peptic ulcers or irritation of the gastrointestinal tract. This has included antibiotics to treat Helicobacter infections, histamine H2 antagonists to reduce gastric acid secretion, and antacids for symptomatic relief. Sorry. Most agents act by inhibition of the gastric acid production, neutralization of acid, or protection of the gastrointestinal mucosa from acid injury. Sorry. These agents are used for both prevention and therapy duodenal gastric acid disease, as well as to alleviate acid reflux, esophagitis, and minor upper intestinal discomforts. These are some of the most commonly used drugs in medicine and are generally well tolerated and rarely result in serious adverse events. Nevertheless, both of these classes of agents have been linked to rare instances of active liver injury. The major, most potent and effective anti-ulcer medications are the selective histamine type 2 receptor blockers, the H2 blockers, and the proton pump inhibitors, the PPIs. Both classes of anti-ulcer medications block the pathway of acid production or secretion, decreasing gastric acidity, improving symptoms, and aiding in healing of acid peptic disease. The pump inhibitors. They directly suppress gastric acid production by blocking the proton pumps in the gastric parietal cells that is responsible for acid secretion and thereby promoting the ulcer healing. Their effect on suppressing gastric acid production is as strong as the of histamine 2 receptor antagonists. They are available in various dosage forms such as tablets, capsules, and injections. I put a little cat here because he is so happy now that he doesn't have pain on his stomach anymore. That's how I feel when my stomach is good. The histamine 2 receptor antagonists suppress the secretion of the gastric acid by blocking the actions of histamine, a protein produced by the body that simulates gastric acid secretion. That's why you should have those kind of drugs away before any meals, so they can protect their lining against any like excess of acid or spices food. Example include cimetidine, famotidine, and ranitidine. They are over-the-counter medicines and are available in form of tablets, capsules, syrups, and injections. Famotidine, a histamine H2 receptor antagonist used to treat duodenal ulcers, benign gastric ulcers, GERD. Side effects are uncommon, usually minor, and include diarrhea, constipation, fatigue, drowsiness, headaches, and muscle aches. Sulcofrate, a gastroduodenal protective agent used in the treatment of gastric and duodenal ulcers and to prevent duodenal ulcer recurrence. My case of study is a nurse gave sulcofrate in liquid form to a diabetic patient with high blood sugar and antacid together. The nurse was in a hurry that morning and did not have sulcofrate in tablets. The antacid was supposed to be given 2 hours after the sulcofrate. What did the nurse do wrong? Well, the recommendations are that diabetic patients should not take sulcofrate in liquid form because it contains carbohydrates, what will raise more the blood sugar that was already higher. The patient's blood sugar was high. Antacid should not be given with sulcofrate because it contains aluminum. It could cause the drug alteration in the efficacy of the drug. The nurse intervention. So the nurse must monitor the patient's blood sugar, access and monitor vital signs, perform detailed pain assessment, and inform the MD about the medication error, because if the order is for tablets or capsules, do not give any liquid unless the doctor told you so. What medications could interfere with sulcofrate? Some products that might interact with this drug include antacids that contains aluminum, certain antibiotics, for example, quinolones such as ciprofloxacin, levofloxacin, tetracyclines, digoxin, ketoconazole. I'm sorry about pronouncing these medications. It's sometimes I don't really know how to pronounce them. Thyroid medications such as levothyroxine and liothyronine. Recommendations: take small but frequent meals and eat at regular time. Avoid spice and excessively rich food that they are irritable to the gut. Do not smoke and avoid drinking alcoholic and stimulating beverages such as coffee and strong tea. Drink milk and eat milk-based food that might help to relieve the pain. Avoid situations causing stress and anxiety. Oh, this is a tough one. Do regular exercise to help you relax. Drug interaction. Take antacids and other medications 2 to 3 hours apart to minimize interactions. Avoid use of sodium bicarbonate in patients who must control sodium intake. Example of people that they have heart failure, hypertension, renal failure, cirrhosis, or pregnancy. And take 1 hour before meds. Precautions. Use with precautions a patient with hepatic impairment. Patients is at risk for osteoporosis, should maintain an adequate intake of calcium and vitamin D, and pregnancy. And these are my reference I took from some of the sites. It was very good information. I like it very much. And this is my presentation, Professor. I hope you understood everything. If you did, please let me know. We can still do in person or at the Zoom, with the Zoom conference. Thank you so much for this opportunity. Have a great day. Bye.